Hello everyone, in this video I am going to tell you about chronic bronchitis and emphysema. As I have already told you about their etiology, their pathophysiology and their treatment in the previous videos of chronic bronchitis and emphysema. If you haven't watched them, watch them right now, then we will come to this. So why I have written this differentiating factor? Because we have to differentiate between the patient of chronic bronchitis and emphysema in the hospital setting. So there are some minor, or you can say very minute differences between these two. So we will first look at the clinical features which I have written right down here and investigation part. So we will look them one by one and see what happens in case of chronic bronchitis and what happens in case of emphysema. So first of all, cough. So usually cough, this is the first symptom. So cough, chronic bronchitis patient, it will come before the shortness of breath. So first cough will happen, then there will be shortness of breath. So this usually indicates that he is a patient of chronic bronchitis. And in case of emphysema, the cough usually happen after the shortness of breath. So the patient will have shortness of breath first and then he will cough. So this is about the cough part of the clinical features, differentiation between chronic bronchitis and emphysema. Now second we will see dyspnea. Dyspnea, or you also know it as shortness of breath. So shortness of breath is a symptom which is mild to moderate in chronic bronchitis. So in chronic bronchitis patient, the dyspnea, or you can say shortness of breath, is mild to moderate, while in case of emphysema it is very severe. So shortness of breath is the second symptoms. So this is the difference between chronic bronchitis patient and emphysema patient. Third, we will look at the sputum. So sputum is usually very present in very large amount in case of chronic bronchitis patient. So if the patient complains that he is coughing very large amount of sputum, so that usually indicates that he is a patient of chronic bronchitis. And in case of emphysema, the sputum is present in very small amount. So this is the major difference between the sputum quantity, you can say, between chronic bronchitis and emphysema. Now the fourth clinical feature is cyanosis. So we will see bluish coloration due to less oxygen in the body. So in chronic bronchitis, the cyanosis will be present. In chronic bronchitis, the cyanosis will be present, while in case of emphysema, the cyanosis will be absent. Next symptom, or you can say clinical feature, if we will see, is pulmonary hypertension. So in case of chronic bronchitis, pulmonary hypertension is usually early and severe. So pulmonary hypertension in case of chronic bronchitis patient will be early and severe, while in case of emphysema, it is late and usually mild. So this is the difference of pulmonary hypertension in both the patients. Now right side heart failure. In case of chronic bronchitis, there will be repeated episodes. There will be repeated episodes of right side heart failure, while in case of emphysema, it usually happens in the late stage of the disease. So this is all about the clinical features that I have tried to tell you, that when a patient will come to you in the hospital, how you have to differentiate it by just looking or by just asking him about his clinical features. And this is all about chronic bronchitis and this is all about emphysema. So now we will go to the investigations. So what investigations we can do to differentiate between these two subtypes of chronic obstructive pulmonary disease, as they both comes under COPD. So first we will look at the chest x-ray. So in case of chest x-ray, in chronic bronchitis, if the patient is suffering from chronic bronchitis, there will be increased bronchovascular markings and cardiomegaly is seen in case of chest x-rays of chronic bronchitis patient. While if we will see at the emphysemic patient, then there will be hyperinflation, bulle and tubular heart is seen in chest x-ray of emphysema patient. So this is the major difference between the chest x-ray of both the patients. Now we will look at the PaO2. In case of chronic bronchitis, it is quite low. The partial pressure of oxygen is quite low, while in case of emphysema, it is normal to low. So this is the investigation which we have to look closely. Second, another investigation is partial pressure of carbon dioxide. So in case of chronic bronchitis, it is high. It is high. PaCO2 is high in chronic bronchitis, while in emphysema, it is normal. Now next look at the hematocrit. So hematocrit in chronic bronchitis patient will be increased. So the increased hematocrit will be leading us towards the chronic bronchitis diagnosis, while the normal hematocrit in patients will generally seen in emphysema. Now the last is diffusing capacity. So the diffusing capacity in case of chronic bronchitis patient is normal, while in case of emphysema it is reduced. So I hope you have all liked this video, or you have understand what I am trying to say here, the difference between both the chronic bronchitis and emphysema. So thank you very much for watching.